It is 8:30 a.m. and you are giving Mr. Duchamp a full bath in bed. Because he has an indwelling catheter, care for his genitalia requires particular attention.
Good morning, Mr. Duchamp. My name is Cynthia, so I'll be doing your personal hygiene this morning, okay, in your private parts, and also cleaning the catheter, okay? Perfect.
The PSW arrives and informs the user that she is going to wash his private part and catheter. Genital hygiene with an indwelling catheter requires particular attention. It must be done at least once per day or whenever soiled and after the user has had a bowel movement to prevent contamination and microorganism proliferation. The PSW must make sure light yellow urine is flowing freely in the catheter. The PSW washes the penis as follows. If necessary, she retracts the foreskin and cleans the meatus with circular movements outwards. Each movement requires a clean section of the washcloth. She cleans the rest of the penis and scrotum, rinses with clear water and a clean washcloth. Then she dries using a light tapping motion. Always work with integrity. Check for redness, odors, pain, and/or discharge around the catheter. If so, notify the nursing staff.
All right. That's done, so I'm just going to wash the catheter now, okay?
The attendant washes the catheter as follows. She holds the catheter in one hand to make sure it is not pushed in while cleaning. She uses a washcloth and soap, moving from the meatus to the collector pouch. She uses circular movements on successive 10-centimeter sections. She rinses thoroughly. At all times during the intervention, the PSW must handle the catheter carefully, making sure it is not pushed inwards into the bladder. Also, after cleaning, if the attendant sees urine in the catheter tubing, she must empty it to prevent stagnation in the bladder area, which could lead to infection. The collector pouch must always be lower than the bladder to prevent backflow.
So your urinary pouch is quite full. So what I'll do is I'm just going to open it, okay? Empty it, all right?
If the pouch is half full or more, it should be emptied. It must also be emptied at the end of each work shift. To empty the collector pouch, place a piquet on the floor to absorb potential spills. Position the cup on the floor and adjust the bed height as needed. Put on a pair of disposable non-sterile gloves. Release the tube press and let the urine flow out, making sure the tube press does not touch the container. Once the pouch is empty, reset the tube press. Check the urine for any irregularities and record the amount if necessary. Discard the urine in a toilet.